As pharmaceutical companies wait for emergency approval of COVID-19 vaccines, many are wondering if they can be used on children.
Joining us now to talk a little bit more about this is Dr. Rhonda Oram, an infectious disease specialist at Advocate Children's Hospital. Nice to see you. How are you doing?
Thank you. Thank you for having me.
All right, let's talk about these vaccines that have been in the news lately and the amount of testing that has actually been done on how effective they would be on children. Has there been any?
There are no data yet on the vaccine being used in children, but we're very optimistic that the age of enrollment will be lowered to start including, older children, and then we hope will go down, in age with time.
How soon could that happen? Are we talking about the next few months, or are you still thinking that's years away?
No, I hope it's not years away. I believe that Pfizer has already initiated lowering the age to 12 years. And so that's definitely an improvement. And many organizations are really advocating now to start including children.
And in terms of younger kids, we've heard that they don't not only get COVID-19, but also transmit it as easily as older people. Does that mean kids under 12 might not need to get a vaccine?
So that is true that most children do not have the severe breathing problems that adults do, but we are seeing a post-inflammatory COVID condition in children in all ages, very young ages, that can be very serious. It affects and inflames the heart. And so even though that's less common than the serious breathing problems in adults, it's still very serious in children. So certainly we would want a vaccine to prevent that condition. And we know that kids will transmit. They are, spreading the infection. So a vaccine, even in younger children, I believe would be beneficial.
And I'm going to ask you to speculate here a little bit when it comes to schooling. A lot of our kids obviously doing remote learning. When it comes to them going back to school, what sort of a role will this play if they can't get vaccinated, let's say in the next month or so, when it comes to reopening school and the risk that maybe perhaps some of the teachers and staff would take by going back?
That is a very tough question. This would be pure speculation. I'm hoping that the vaccine in the adult community will certainly make it safer and decrease our community spread. But we have to be very diligent in continuing with all the measures that are recommended by public health officials, because, the vaccine is not going to magically make the pandemic disappear. It will help on the right track. But we still need to mask and socially distance and wash hands.
I'm sure you have a lot of patients and their parents asking that question about schools, though, and whether it's safe to send kids back, in the next few weeks or month or two before there is widespread vaccination. What are your thoughts on that?
I think school is so beneficial to children, but we want it to be a safe place for teachers and for children. I think that if we can really get through the next couple weeks and decrease community spread, keep all those measures, in place in our communities and in schools, then it can be a safe place for children, but I cannot predict. I wish I could.
Yeah, we understand. Okay. Thank you for joining us, Dr. Rhonda Oram, an infectious disease specialist at Advocate Children's Hospital. We appreciate your time today.
Thank you.
Thank you for having me.
Well, we have a special story on this Giving Tuesday.
The next day after I'd posted, and I couldn't even see my